All right, so last day we were talking about pregnancy a little bit. So we're going to get back into talking about that, talk about lactation and feeding an infant and those kind of things. And yeah, so there's lots that could be said about that. Let's just recap a couple of things that we were talking about. As I mentioned last day, one of the number one things a woman can do before getting pregnant is being healthy and having a good supply of iron and folic acid, because of course that's all going to help develop the placenta, and the placenta directly nourishes the baby, and so all of that is good. So this is why they recommend these prenatal vitamins as part of that, particularly for the iron and the folic acid, because those are helping to develop the baby. There's all sorts of studies and kind of correlations and not really fully understanding what's going on, looking at the placental health and how that correlates with the child health and those kind of things. And that's something that I know one mother that came up, they did an ultrasound. I think it was about 3 weeks before the baby was being born, and they saw abnormalities in the placenta. And so they had decided to basically induce and have the baby come out about 2 weeks early for that reason, because the baby's survival, or at least health, would have been better coming out than dealing with a placenta that had some evidence of damage or calcification or something like that. I'm not entirely sure about the entire situation, but you hear about these things all the time. And this is kind of, the advantage of modern medicine with these ultrasounds. You can look at those type of things too while you're looking at the health of the baby and all that. So good placenta means a good start. And that's where we want to be. And there's lots of pushes towards getting women to take these vitamins when they find out they're pregnant, if they're not on them already. And this is a good thing. We can prevent spina bifida. And like I said, iron is super important for the baby, right? There's all sorts of programs out there. If you do get pregnant and all that, you'll probably end up seeing, like I said, ads and all sorts of things, whether it's at the doctor's office, midwife, whatever. There's tons and tons of programs trying to help women get the right information for their prenatal health, and also after post-birth and those kind of things. This is one organization here, the Canadian Prenatal Nutrition Program, and you can check them out. This is part of their flyer, and it's, of course, one of the things it's talking about is prenatal vitamins, but you can see the program involves all sorts of other things. You can see they've got breastfeeding assistance and mental health and just a little bit of everything in there. So maybe I'll say one thing about having kids. If you haven't had them already, you'll notice that people love giving advice. It is crazy, right? Everybody in the grocery store, your mother-in-law, your whatever, they want to give you advice. And, we all deal with that differently. But I will say this, that the advice on these kind of things does change. So if somebody is giving you advice because they read all the top parenting and breastfeeding books or whatever it is in the 1980s, chances are information has changed. And you'll even notice that between child, that it's worth it to take a look at some of the current information, because once in a while things do change, and that happened to me. In fact, with respect to the advice on allergies. So I'll get to that. Not sure, maybe today, if not, it'll be next day. But just be aware of that. One thing to know, there's lots of advice out there. It's always worth it to look into things for yourself to see what the current best practices are, and to try to sift out between what is just general advice versus what is actually good information. So just keep an eye for those kind of things, right? And these type of organizations, that's their job, is to try to figure out what the best practices are. And hopefully that is indeed the case, best practices. Let's talk a little bit about weight gain during pregnancy. That's obviously going to happen, and that's good. It's good for the baby. It's good for the development of the placenta and all those kind of things. And of course, this is the thing that a lot of women talk about because they're concerned about gaining weight and not losing it later. But this is all part of the package, unfortunately, of growing another organism inside of you and trying to make it large and healthy and those kind of things. So you can see there's some guidelines there about the recommended weight gain. Most numbers I see are in kind of in that 30 to 40 range. You know, I've seen 30 on the low end. I've seen 35 as maybe the average. I've seen some recommendations a little higher. It does depend on your actual BMI and kind of where your pre-birth weight, your pre-pregnancy situation is as well, right? Some people are tiny people, some people are much larger, et cetera, right? So there's all sorts of guidelines on that kind of thing. I think I've got a little chart here that shows you kind of your typical weight gain. So you can see it, like I said, around 35 pounds. 32 it says on there if you add everything up. But so the biggest thing is actually the increase in fluid and blood, even more than the actual baby. So that includes fluid and blood that's in the placenta and also fluid and blood in other tissues, including your own tissues as well. You can see all sorts of other things in there, right? You know, that come into small amounts of usually breast mass increases. Usually women gain extra fat stores, which are actually important for breastfeeding later, is having a little extra energy on hand. Again, it kind of depends on the person, right? Some women have a hard time gaining weight while pregnant, at least initially, due to things like morning sickness and food aversion and weird smells. And other women are the exact opposite. They want to eat everything in sight. And hopefully, you know, we're doing this in a healthy kind of way. The number one thing to not do is go on a diet while being pregnant. You should not be losing weight, you should be gaining weight. If you are have a larger BMI, maybe your weight gain is a little bit lower, you don't need to perhaps gain some extra fat stores, but you do need to gain weight to you're forming a placenta and a fetus and those kind of things. So that's the number one thing to not do, is do not diet while you're on a pregnancy. In fact, some people will change their diet habits in general. For example, I've known vegans that have decided while pregnant they were actually going to eat meat in order to get the iron that they need and the protein and those kind of things. And so, you know, if you're looking at making some dramatic changes and those kind of things, particularly if something you're concerned may not be healthy, always consult, right? Consult your physician or a dietitian or somebody like that who really knows what they're doing. What about exercising? Generally, it's a good idea. Exercising is always a good idea. You may need to modify what you're doing. Generally, you don't want to be doing things, particularly later on in the pregnancy term, that may be not good for the fetus, like, you know, jumping on a trampoline or boxing or something like that. Hopefully that's kind of obvious. There's a lot of things that are kind of in between, right? Like jogging. I've known pregnant women who have jogged right up to about 8 months, which I think is incredible. I have no idea how comfortable or uncomfortable that is. Apparently that is okay as long as it's relatively low impact. You know, generally there are all sorts of exercises that can be modified, or some are a little bit easier. Swimming, for example, you know, you've got the water supporting your weight, and you know that tends to be a little bit lower impact and not so hard on the joints and things like that. Of course, everybody's body is different, right? I've known some women that their joints swell, right? Their feet, they can't fit into their shoes. You know, that's going to affect your ability to exercise and whatnot. Generally, earlier on in the pregnancy, you have less weight, less issues is generally the thing. And having a little bit of cardiovascular fitness is good. Can help you with all sorts of things. You know, that mental health for some women is a big deal, and exercise can help with mental health. You know, being healthy overall can help you with labor and those kind of things as well. Don't go overboard. I do remember reading a case years ago about some woman who had decided she wanted extremely fit, and then in the end she had like extremely strong stomach muscles and things like that that actually made it harder for the labor and all that. So always, again, consult if you're doing anything unusual, right? You know, I probably would not advise a marathon, but I wouldn't be surprised if somebody out there has done it, right? But, you know, all these things are good. You can see there's some suggestions there. And again, this is the kind of thing, if you Google pregnancy and exercise, there'll be 1,000 websites giving you advice or suggestions or things to do, how you can modify your existing sport and whatnot. But generally, like I said, the later in the pregnancy, you want to be reducing anything that would potentially affect your health or the health of the fetus. So like I said, we want to avoid boxing and things like that, right? For sure. Some guidelines, right? So this is not too bad. This is kind of your typical advice, right? Exercising regularly, having a little bit of warm up and cool down, and those kind of things may be affected by, again, changes in the body. Anytime you have dramatic changes in your body, whether you're pregnant or not, like if you suddenly just start doing intense exercise, that's going to be difficult for you. So you may have to change your warm up and cool down and those kind of things. And often extra fluids are a good idea as well. Just looking at this to see if there's anything I missed. Oh, the other thing that's important, you can see on the don't thing part, is avoiding heat, right? So I know a lot of people work out and maybe they're at the swimming pool and they want to go in the hot tub. We want to avoid hot tubs and saunas when we're pregnant. And along with that, with exercises, if the weather is excessively hot, this can be really bad for the fetus. And also a lot of women experience blood pressure issues during pregnancy. So those are some of the things that you want to pretty much avoid. Scuba diving, yeah, there's another one. Hopefully that one's kind of obvious, right? What else do we have here? Tips for relieving common discomforts. Yeah, I'm not going to go through all of these here, but usually a lot of these are kind of the typical kind of health things, right? So eating healthy, having lots of fluid, lots of fiber. There's all sorts of changes that can occur in your digestive tract when you're eating for two and your body's changing, and constipation is one of them. So fiber is a good one that can help with that kind of thing. Just looking to see if there's anything else in there. Again, everybody's a little different, right? Around things like spicy foods and all those kind of things. I mean, every pregnant woman will tell you all about it, I'm sure, or what their experiences were in terms of those kind of things, right? Extra gas, extra snoring, like, I mean, you name it. When your body's changing, you're dealing with all sorts of different things. Like I said, I'm not going to go through all of those kind of things. So here's the other interesting thing and the trend that's been happening over the years in terms of, the age where women are giving birth has been increasing for decades now. I saw some, I think, 2016 data, and the 2016 data was the average age was 30 point something, right? So now we're up to 31.3. And so that's not a bad age, but as people do get older, things do get harder. You can imagine if you're 21, you could be a lot more fit. Your body is a lot more able to heal, those kind of things. I know a number of women who had their first baby at age 39, 40. You could imagine how that is different from 30 or 21 and so on. So this is something that the health experts are certainly looking at and trying to understand, but usually the principles are the same, right? Being healthy and having lots of nutrition is always a good thing. What's going on here? There we go. Kind of going hand in hand with this. It's worth to mention a little bit about teenage pregnancy. When a person is a teen, and again, depending exactly where they are, they're not necessarily fully developed in a lot of ways. A lot of teens are maybe not necessarily eating the most nutritious of diets in general. We'll talk a little bit about teens in the next unit, but generally teens tend to do things like stop drinking milk and replacing it with soft drinks. Sometimes they're experimenting with nicotine or alcohol and those kind of things. And so these are all sorts of high risk things, along with having a body that may not necessarily be fully ready for this kind of thing, having, for example, sufficient fat stores and those kind of things. So you can see there's some risks, right? Generally, the risks to the mother are, there's nutritional, but there's other things like, for example, a lot of teen mothers do not necessarily finish school or go to college or things like that, which can have, effects on her life and the life of the child, of course. But there is higher maternal mortality and higher infant mortality with teen mothers for all sorts of various reasons. The big one, though, that we keep getting back to is low birth weight, right? And that has the highest risk for the child. And so it's important that teen mothers do get proper nutrition. Not going to say too much more about that, but like I said, there are higher risks. Cigarette smoking. Yeah, again, I'm not going to say too much about that. If there's any one thing that anybody can do in their life to improve their health, it's not smoke. Risks of cancer, cardiovascular disease, the toxins do go to the child. There's been all sorts of studies where they look at what happens to the fetus and the heartbeat when the mother smokes, and none of it's any good. One of the other things that it increases is SIDS. That's a sudden infant death syndrome. That's kind of a cluster of conditions where a child is alive, it's born, and then it's not alive, right? And there's various reasons for that, but it is connected in some cases to tobacco smoke. You can see a low birth weight. There's a bunch of other things we could throw in there as well. So what about drugs and other herbal supplements? There's 1,000 drugs and supplements out there. Don't start medicating yourself without asking a healthcare provider about what's going on. Some are apparently just fine. Some things are going to be high risk to the child, of course. So like I said, self-medicating when you're pregnant, not necessarily a good idea. A lot of things can cross the placenta. And that's part of the deal, right? In terms of, are we concerned about this thing crossing placenta or not? So always, ask about these kind of things. Other environmental contaminants, I feel like we talked about this already. Maybe we're talking about bioaccumulation of things like mercury and whatnot. These kind of things can also affect the child, right? Mercury, for example, is definitely very bad for the brain. So with consumption of things like tuna, there's recommendations around that. I think like it's once a month when you're pregnant or something like that in terms of the concentrations that are in some of these larger ocean fish. So some things to look into if you're pregnant. Cannabis. This is something actually I've been trying to look into for the last few years since it's been legalized in Canada. And the answer is still, we do not have a lot of studies on a lot of things around cannabis and marijuana use. A question? I'll get to you in a second. Yeah, and around all sorts of things. I haven't necessarily been looking into cannabis in pregnancy, but cannabis and lung cancer and all sorts of things. And we have a lot of good studies that have been done, on things like cognitive impairment, in terms of things like driving and being under the influence and things like that. But pretty much many areas of cannabis use and health, long-term and otherwise, we're just not there yet. We have some good studies on heavy users, but casual users, giant question marks. So this is the kind of advice you're going to see is probably a good idea to avoid it. And you'll see things like it may affect fertility. It may be linked with low birth weight. Again, there's another one that we're concerned about with low birth weight. And there may be, again, it's all maybe because we really don't know. And especially, if you look at the typical user, right? What does that even mean? Some people it's once or twice a year, some people it's once or twice a day. So all these kind of things we don't fully understand yet. Question, comment?
I was just gonna say, I was having a conversation once about like marijuana and like birth and stuff like that with a social worker in Ontario, and they're actually saying right now that it's worse. Like what they're seeing is that it's worse when mothers are consuming marijuana while they're breastfeeding, because like the babies are consuming that. So
for sure, yeah. There's a lot of drugs that will cross into breast milk. Like, we know caffeine for sure, right? So you can imagine these kind of things. Like I said, there's a lot of anecdotal kind of information from social workers and nurses and dietitians in terms of kind of put things together as a big picture. It's kind of it's loose still. Again, probably not a good idea, but in terms of where the hard data is, we're still kind of working on that, right? And these things take time. See here, there's another comment. So somebody has a comment about when her youngest was born with ventricular septal defects. They asked if she used cannabis because there's a connection between that and cannabis use. Right? In that case, it was genetic. Yeah. So there's a lot of things that are connections, right? A lot of these things, low birth weight, right? There's about 100 causes. Again, lots of links and all those kind of things. And, I think the questions with these kind of things, always is, how much is too much, right? Is anything above 0 too much? or not, we don't know. But probably not a good idea to use or abuse drugs while pregnant or breastfeeding. So one of the other concerns that we did talk about in terms of foodborne disease was Listeria. So as I mentioned before, Listeria is connected with all sorts of things, contaminated possibly with feces. Kind of the number one thing that is often connected with is contaminated lunch meats and certain soft cheeses. So soft cheeses sometimes are made with unpasteurized milk. And so you'll see some pregnancy guides basically saying avoid these things entirely, lunch meats, unpasteurized products, and those kind of things. It's not that common, but when it does happen, it can be really bad for the fetus. This can get into the blood and can lead to stillborn births, right? So the risk is really high to the fetus. This is one of these things. Listeria is one of the things that if you're healthy, you might get sick, but you're going to survive, right? But if your immune system is impaired, so say you're a very old person, or you are an AIDS patient, or if you're a fetus where you don't have an immune system yet, this can be actually quite fatal. So this is one of these things to think about a little bit. You see some recommendations there about mostly around meats, unpasteurized products. A few other things are mentioned on there: pâtés and spreads. Look at the best before dates, wash your fruits and vegetables. Every once in a while, there are Listeria outbreaks connected to certain types of produce. I think I mentioned before there was a massive cantaloupe recall a few years ago, and I think 14 people died in the States from it, which is quite a few for a Listeria outbreak in general. So one of those precautions to think about, right? What other cautions here? Watch out for vitamin A. Vitamin A toxicity can cause birth defects, so do not megadose yourself with vitamin A. We talked about restrictive dieting. So artificial sweeteners is one of those things, again, there's always lots of controversy around artificial sweeteners, and it's not that it's going to cause cancer or anything like that, but I think the biggest concern is that it's replacing healthy other foods. There are some warnings around high doses of some of them. Again, you got to be careful. You can't just treat them all like they're the same thing. So again, usually with the artificial sweeteners, the recommendation is, enjoy them once in a while. Don't make them your main part of your diet. Don't rely on them. And in the case of pregnancy, we want to get nutrient-dense foods, and that's not going to help you out in general. What about caffeine? So caffeine will get in your blood and it will go into the fetus. In terms of the research, probably no long-term effects, but it does affect the fetal heart rate and those kind of things. And we probably don't want to mess around with that too much. So this is basically the recommendation is about 300 milligrams max. So I was looking that up, and that's about one large Tim Hortons coffee, slightly more than that. If you're getting something else, Starbucks and whatnot, you can get all that information from their websites, how much caffeine is in a particular drink or beverage. The other thing, I'm not entirely sure about this. I don't drink Tim Hortons coffee, but I think they changed the sizes recently. I don't know if they made them smaller or bigger, but those kind of things. But generally, one large cup of coffee, that's a pretty decent recommendation for most people. That will get them through the day. If you're a high caffeine user, then something definitely cut back on for sure. And I think I mentioned a few minutes ago that we do know it crosses the breast milk as well. And you can see sometimes people who have a lot of caffeine, the effects are the babies will get jittery and whatnot, right? So probably want to avoid that kind of thing. So I just missed something there. Okay, so alcohol is something that we can talk about quite a bit, and there's actually a lot of research on this kind of thing. So alcohol, of course, gets absorbed to the blood very easily, crosses the placenta very easily, and is toxic to the fetus. Pretty much everybody is recommending you go to zero on this. There are some places, and I've seen this. I was looking actually the other day on the website about alcohol and pregnancy to see kind of see if there's any updates on the research. And I actually found a decent number of websites that said something about the occasional drink may not be a bad thing, right? And so I don't know whether this has something to do with the research or not, but generally, this is the kind of thing that we do know that it affects the fetus and in a lot of ways that have been measured scientifically. And so the recommendation is basically that there is no safe amount and probably a good idea to avoid during breastfeeding as well. I'll talk about breastfeeding in a few minutes though. But you can see some of these damages, right? Limiting oxygen delivery to the fetus, right? That has effects on the brain and can have all sorts of other effects depending on the amount of consumption and whatnot. So always good to avoid alcohol during pregnancy. And you may have heard about fetal alcohol syndrome. This is reasonably common because people do drink while they're pregnant, and this can have all sorts of physiological and cognitive effects on the baby. I had a good friend in high school, a sister, an adopted sister. She was had this syndrome, and the thing I remember about meeting her was that her face had a weird shape to it, right? So you can look this up on the internet in terms of what's going on with the shape. You don't necessarily know what you're looking at right away, but you can see this is talking about some of these things, the narrow forehead and the nose and those kind of things. So something to do with the development there. But the big one for her was cognitive and behavioral difficulties, right? And that's the one thing I remember about her. So another thing that we did talk about before was some women get gestational diabetes. My sister had 3 pregnancies. This happened with 2 of them. And so what does this mean? It means that your blood glucose level is higher than it should be. And so this is the kind of thing when you are pregnant, they are going to test your blood and look for this. And in some cases, it might mean you need to deal with your diet a little bit, avoid sugary beverages and things like that. I think that was the case for my sister. It was mainly just cut out the sugar and she was able to control it. But you can see that this does give some risks, right? So it's more risks to complicated births. And people with gestational diabetes tend to have more surgical interventions that are often unwanted. And also people with gestational diabetes are also more likely to have diabetes later in life, type 2 diabetes. So again, something to kind of keep an eye on. Generally, who's going to get it? The correlation is the same as with type 2 diabetes, is that obesity is the correlation with gestational diabetes. But anybody apparently can get it, if particularly there's a family history of it. So you'll get your glucose tested, and again, something to keep an eye on. Another reason to kind of keep an eye on your nutrition while being pregnant. It's hard to stay away from the ice cream, though, isn't it? So what about hypertension? Again, relatively common. Not necessarily any correlations, between who's getting this one. I think again we're looking at obese women, but I've known very skinny pregnant women who have had this issue. I know one who she told me her blood pressure was always extremely low, to the point where the doctors were worried about her having low blood pressure. And then when she was pregnant, she had high blood pressure and had to monitor it. And they were very close to giving her some sort of medical intervention. I don't know all the details there, but she had to buy a monitor and keep an eye on it the whole time during pregnant. And then when the baby was out, it was gone, back to the kind of low blood pressure kind of thing. So, kind of the general things around hypertension, right? People getting dizzy and things like that, which is something actually is pretty common when you are pregnant and sort of in the later term, those kind of things. But you can see some warning things, right? Lots of headaches, dizziness, sudden weight gain, those kind of things, weird swelling, those kind of things. Something to watch for. I guess I didn't define preeclampsia, but you can see it's there on the slide. Also looking at having high protein in the blood as well. So relatively common, 1 in 20, not usually a big deal, can be controlled a little bit, but something that might need to be monitored. Okay, what else was I going to say here? I feel like this slide is ahead of where I want it to be, but let me just take a peek at where we're at. Okay, yeah, okay, I guess that's where we're at. Okay, so baby's born and we want to feed this thing, right? So generally, the recommendation is they're really pushing breastfeeding. And we'll talk about why that is in a minute. But people can do formula feeding as well. But in terms of the nutrition for the baby, these two options are the best. Obviously, a baby, when it's born, it does not have the capacity to chew food or anything like that. And a baby's nutritional needs are almost completely covered with breast milk or formula milk, right? And so there's lots of consultation, and there's specialized nurses, and there's tons of support in the public health system for helping people to learn about lactating. Some people are scared of it. Some people don't want to do it. Some people are thinking about their jobs and those kind of things. And all those things, you know, if you're concerned, see a specialist that can tell you all sorts of things about it. There's lots of things to do, right? Some people are working, so they may pump milk and store it in the fridge. And there's lots of other things to say about that. The general thing is that most people can make enough milk if they stimulate the lactation properly. Sometimes people cannot. And often it's more to do with people not stimulating their nipples properly, or people that are malnourished. And generally what's going to happen is the milk quality is usually good. It's the quantity that might go down, right? And usually that's something that everybody who's pregnant or breastfeeding, they're learning these things. But kind of the big thing is looking at the baby's diapers, making sure that the baby's having enough of them, kind of like, I don't know, 6 a day or something is pretty common. If they're having 2 a day or they're dry, they're probably not getting enough food and liquid in there, in their diets. But anyway, like I said, kind of the big thing to do is to read about it and learn about it if you're going to be doing this for the first time. Lots of benefits of breastfeeding. Probably too many that you could put in one poster. Like I said, kind of one of the big benefits is that breast milk is almost the perfect food for an infant. So why not go with it? But there's lots of other reasons to breastfeed. It provides intimacy between the mother and the infant. It can help the mother lose some of that weight she gained during pregnancy. And there's other benefits to the baby in terms of things like breastfed babies have less allergies. They tend to have a slightly higher IQ. And there's study after study after study looking at all of these kind of things, which are very, very interesting. You can notice this other thing here is that the breast milk has antibodies in it. So the mother is conveying immunity to her child by breastfeeding and helping to protect it against infections. Because the immune system, it takes like 6 months to a year to really get fully kicked in and developed, depending on which part of the immune system you're talking about. When they're born, right away, they're relatively susceptible. So the mother has probably been exposed to the germs that are in the air at the time. And by conveying some immunity to the baby, that's a great thing. The one thing that breast milk is missing is vitamin D. Right, we talked about that one already, and this is something that is strongly recommended in Canada, that all infants get supplemented with vitamin D along with the breast milk. But it contains pretty much everything else, even vitamin C and iron. Now, the one thing I'll get to in a few minutes is that iron stores on the mother may last for maybe 6 months, kind of thing, right? In terms of as enough on the breast milk. So iron is the other thing that we're mostly concerned about. And as the baby gets bigger, eventually we're going to be a little more worried about vitamin C as well, getting enough of it in the diet. But there's like I said, lots of benefits of breastfeeding in terms of all sorts of things. And you can, like I said, tons and tons of lists on these kind of things. The other thing breastfeeding will also do is help regulate a mother's hormones. And some people will talk about breastfeeding as being a form of birth control. Don't rely on it. But generally what it does is if a woman who's breastfeeding, it takes a little longer for her to reset her clock and is less likely to get pregnant again right away, which for many people is something they probably don't want to have two so quickly together. Lots of good things in here. A couple of things to say about breast milk. One thing is to say that if you take a look at the diet recommended for baby versus the diet recommended for adults, it's a little different. Babies need tons of fat, tons and tons of fat. And that's what is in breast milk, human breast milk anyway. We don't want to give a baby cow's milk for at least, I think the recommendation is 9 months or something like that. Cow's milk does not have enough fat in it. It's formulated for another animal. Whereas human breast milk has lots of fat in it. It has those essential fatty acids, those omega fatty acids, the linoleic and alpha linolenic acid, and the longer derivatives, the DHA, and I can't remember the name of the other one. It's probably on the slide there. Yeah. And those are all part of brain development. And so this is the kind of thing where we think this might have something to do with, and so the formula makers are trying, they're adding more of this stuff in to make their formulas better and closer to breast milk, because breastfed babies, like I said, they tend to have a tiny bit of an edge on average for IQ. There are carbohydrates in there. The main carbohydrate is lactose. So you're probably thinking, what if my baby is lactose intolerant? Very, very rare in a baby. Babies, in terms of their genetic regulation, they make a lactase enzyme almost immediately because their expectation is they're going to be drinking some sort of milk product. So lactose for babies, at least, is very easily digestible, and a decent glucose supply, which is, of course, good for the brain and all those kind of things, right? We've got proteins, mainly they're relatively digestible proteins. One of the proteins in there, lactoferrin, is something that helps absorb iron, and which is something the baby needs, right? Vitamins and minerals, they're all in there with the exception of vitamin D, unless the mother is malnourished in some form or another. And we mentioned antibodies and all that. So this is all good stuff, right? So what about the mother during lactation? She's going to produce about 3 cups, so 3/4 of a liter of milk a day, roughly, depending on the size of the baby and all those kind of things. You can get a lot more out of it and all that. If you're pumping milk and storing it, those kind of things. So that means, number one, the woman should be consuming more liquids to provide for that, but also more calories. So you're looking at about 500 calories a day extra are needed. And, there's different formulas on this. The recommendation is people eat about maybe 350 extra, and then the other 150 can come from fat stores to help the woman lose a little bit of that pregnancy weight and those kind of things. But, again, having good nutrition, you'll see lots of lactation nutrition guides talking about things like calcium and iron and those kind of things. And you can see over there on the right, there's some recommendations on that little poster there. So what about formula? So formula, usually what they're trying to do is make some sort of synthetic human breast milk, right? They're trying to mimic it as best as possible. It's not usually human milk they have in there. It's usually cow's milk. And so what they've done with the cow's milk is they've pre-digested the cow milk proteins to make them easily digestible for the baby. And I mentioned that the cow's milk doesn't have the same composition. It's more protein rich, and it's not enough fat. So they actually dilute the cow's milk and they add extra fats from plant and other sources, and they add iron. So that's the one thing, iron and vitamin D, that's the one thing that infant formula has over breast milk, is it's fortified with those two things, which can be a deficiency in babies. Generally, they're apparently getting better at making formula, and this is an option for some mothers for various reasons. Some people can't or are unable to, or other reasons. Maybe you've adopted, and it's the best alternative. So generally, the recommendation is that babies are breastfed only, or infant or formula fed only for 6 months, roughly, depending on the child and if they're ready for solid foods. But that's usually the recommendation. By the way, I guess the other thing I was going to say about the formula is there are other options, right? There's soy-based ones for people that might have milk sensitivities, or for vegans, they may prefer the soy options as well. Yeah, there's a comparison, infant formula with breast milk. You can see they're trying to mimic it, maybe supplement it a little bit, and maybe someday it'll be just as good. But it's close, pretty close. So here's the thing that blows my mind, right? This graph. So take a careful look at this graph. Those little green bars are talking about the nutrition that a grown man needs. and then the nutrition and infant needs. We're talking about like per body weight kind of thing, right? So, I mean, take a look at these things. Vitamin D, an infant needs way, way more per kilogram of body mass than a grown man. Iodine is another one, again, brain development, right? Huge and important for brain development. So pretty much all these nutrients a baby needs in higher quantities, which is why it's super important to feed this thing really well, which is, again, found in the breast milk and formula for at least the first 6 months. So like I said, I like data. Can be very, very interesting. So at some point, going to transition to food. Okay, and generally the recommendation is about 6 months. Kind of depends on the baby's readiness, right? Some are ready to stick things in their mouths, others are not. You know, in terms of where they're at initially, they're not going to have the muscles to do a lot of things. Like a newborn, they have muscles to swallow, but they can't chew or anything like that. Even a 6-month-old baby may have a tooth or two. They can't chew anything, so the food has got to be pureed or mashed or whatever. And there's tons of options out there, about 1,000 products they'll sell you at the grocery store. Some people make their own. It doesn't really matter. But some general guidelines is kind of looking for the baby's readiness. Like I said, some are they're just ready to go right away. It seems around that right time. Others take a little bit longer before they'll, you know, they just put something in their mouth, they just spit it out. Others, they just want to take it in. And those kind of things, you know, ability to sit up and all those kind of things are going to help your baby. Generally, the recommendation is start off with something simple, and usually the recommendation is rice cereal that's fortified with iron. So I mentioned that iron is kind of one of those things that the mother's stores start to get reduced around 4 to 6 months. So this is another reason why introducing solid food can be a good idea kind of around that time to make sure the baby does get enough iron. A lot of them are fortified with vitamin C as well, which is another thing that, you know, once that child hits a certain mass, it's kind of important to get enough of these nutrients into that little body. There are cases where some women, they want to breastfeed forever. And I'm not necessarily going to criticize that, but iron deficiency sometimes happens in these babies. And so that's something to be aware of if you're trying to push that breastfeeding a little bit longer and so on. So food supplementation, we're not talking about going cold turkey, going right from breast milk to food. Most people are doing a combination of both of those things till about a year or more, right? Again, it depends on the mother and the child and all those kind of things. And you know, and sometimes it's the work situation too. Some people have a goal to wean the child before a year because they're trying to go back to work. There's all those kind of things, right, that are going on. There's tons and tons and tons of feeding guides out there giving you suggestions about what you can feed them and you know, being nutritious. Like I said, lots of foods you can buy. You can buy them, you know, those little jars, and it's kind of incredible going through the grocery store looking at the options in the grocery store in terms of all the things that you could feed your child, all sorts of stews and mashed squash, and I mean, it's kind of crazy. And when you have a child, sometimes it's kind of fun just buying one of everyone and seeing which one he or she likes, right? That kind of thing. And some of them, like I said, are ready to eat anything. Some of these babies, like, it's crazy. They're like little vacuums and they just suck all their food in. And then the others are super picky, right? So, you know, when you're a parent, good luck. You sometimes just have to try a little bit of everything. Generally, in terms of tastes, most of them are willing to try all the food groups, with the exception of vegetables, apparently. That's what I've read. I've had different experiences with my children. One of them was more of wanted to eat the vegetable-based plant things and avoided the meats, and the other was the opposite, right? So, you know, keep trying. You can see lots of guidelines here about things to try and suggestions. And like I said, initially, you know, all the food needs to be basically mashed up and pureed because they don't have the ability to chew. And even learning how to swallow is a big thing, right? Swallowing liquids is a little bit different than swallowing food. So maybe the initial foods are going to be more liquidy and working up towards things. And a lot of things are obvious, hopefully. Avoid things they might choke on. So nuts, popcorn, whole grapes, you know, I mean, there's about 1,000 foods that they could choke on, and we certainly don't want that kind of thing happening. Here's a meal plan. You can see lots of ideas in there. And again, you know, kind of depends on what you're eating too, and kind of the recommendation is, you know, give your child a diet kind of similar to what you're eating, and maybe mash up your own foods and get them to try them as well. Like I said, tons and tons of feeding guides. This one's from Alberta Health Services, and they're talking about, you can see serving sizes and lots of suggestions, and you can take a look at these resources. You know, it's amazing, the internet, all of the different resources that are out there nowadays. And, you know, it's not worth it to tell people what to feed their child. They have to figure that out on their own. But anyway, this is the other thing I wanted to mention. I want to talk a little bit about sensitivities and allergies. Okay, it says here, give your baby one new food at a time, right? And then we want to see what they're going to do with it, right? So sensitivities and allergies, they can take up to a day before the baby has a reaction. And some allergies, for example, milk allergies, you know, are reasonably common. I don't know what the numbers are. Maybe 1 in every 30 children or something like that may have a cow's milk sensitivity. So if you're transitioning to yogurt or cow's milk or something like that, that's a good one to feed the child, maybe a little bit, and then wait and see. The reaction may be right away. It may be hours. It may be up to a day later. And the reaction may be all sorts of things. Some children with allergies, you know, they get a skin rash. And that one's a little bit more obvious, perhaps, you know, skin rash on the cheeks or something like that. Sometimes they just get a little cranky because their tummy is not feeling right. So always good to kind of introduce things one at a time, particularly anything that might be a potential allergen. So like I said, milk is a good one to watch out for. Anything containing peanuts is another one to watch out for. And we'll talk about that there in a moment, peanuts in particular. And if there's allergies in your family, then definitely you want that kind of thing to be on your radar. And very, very common for all sorts of sensitivities and allergies. Here's, you can see they're progressing going forward, and eventually, you know, babies will be ready to chew and things like that. And like I said, every child is different. And if you have multiple children, you'll find out that each one is very, very different for sure. Let's talk a little bit about food allergies. I kind of have most of the food allergy stuff kind of in the next unit. But like I said, it's worth it to be aware of these kind of things, particularly, you know, family history of these kind of things. And when I say family history of allergies, I mean all of the allergic diseases, right? I don't just mean food allergies. You could have a history of asthma in your family, and your child doesn't get asthma, but they get food allergies. Asthma is an allergic disease, okay? So something to keep in mind, right? To have that extra caution. And like I said, sometimes skin rash, often they're not old enough to communicate to you, to tell them that, they're not going to be able to say, hey, mom or dad, my tongue feels funny. But that is a symptom of a food allergy sometimes, right? The big one obviously is respiratory discomfort. You know, we don't want the baby to not breathe, of course. So this is something to certainly watch out for, right? For sure. And food allergies are super common. I'm looking at different numbers out there. I've seen one saying 10% of children, one that says 6, another one that said 8. And so very, very common kind of thing. So let's talk about peanut butter. Peanut butter is super, super interesting in terms of the recommendations on this kind of thing. So I have a son with a peanut allergy. And believe it or not, I actually found out like 2 days before coming to Fort McMurray for the first time. I was coming here for a job interview. And on the way here, I read a whole book on peanut allergies. Kind of thinking about this kind of thing, right? And the recommendations around what to do about this, because there are other people in my family with, my nephew has a nut allergy. So this was something certainly on the radar. But the recommendations have completely changed since he was born. And there's lots of really interesting science on this kind of thing. But it used to be the recommendations are keep your child away from peanut butter and nut products and those kind of things for at least a year. That was the recommendation. Because we know from the science that in order to become allergic to something, you have to get exposed to it. But it turns out that this made things worse. There's a lot of really good studies, particularly in the UK. There were some really good studies that showed, you know, when they were being really strict about this kind of thing, the amount of peanut allergies went up. And there were a lot of people that were starting to notice interesting things. For example, I was listening to a podcast about a scientist who was an allergist, and he went to Israel for a conference and was talking about peanut allergies. And the Israeli scientists were like, what are you talking about? This is not that common. And he's like, it's not? And he's like, it sure is in the UK. They're like, there's no peanut allergies in Israel. So it turns out that people feed their babies in Israel these things. Bamba. Go on YouTube. I think there's a cute little commercial where there's a little thing singing and about these Bamba snacks. They're kind of like cheesies. They're puffies, but they have peanut butter in them. And people feed these to their babies when they're like 4 months old. Source of protein and whatnot. And so this and all sorts of other studies, they realized maybe the better recommendation is to desensitize our children to peanuts. Like I said, about getting sensitized to something, peanut residue is like everywhere. It's in a bazillion products and ends up on all sorts of things. And so babies can get sensitized to it even if you don't think they've eaten it. So the idea is to desensitize them and start giving it to them as early as possible. I'm seeing some recommendations even 4 months, which is like crazy. A lot of babies at that age won't take anything into their mouth. But you know, when you start giving them solid foods, they're saying mix a little bit of this in your rice cereal and try to, you know, give them this in their diet right away. And peanuts actually great, high protein kind of food. Don't give them the actual nuts, right? You want to give them peanut butter, you know, or rather than that, you don't want to give them peanut butter straight because, you know, it's sticky. So, you know, mix it in foods and things like that. And this is the recommendations. And like I said, it's really fascinating to read up on all these studies on these recommendations. And I think this is as recent as 2017, where they totally flipped, right, between 2016 and 2017 on the recommendation on this. So super fascinating. Like I said, I could talk about peanut allergies for a while from personal and other experiences. So some summaries, right, on feeding the infant, right? 0 to 6 months, usually breast milk, formula only, somewhere around the 6 months or sometimes a little earlier. When they're ready, start giving them some foods. Particularly, we're looking at those iron fortified foods. Like I said, the rice cereals are usually iron fortified, and so you know that's a good thing to throw in there. What other recommendations on here? Watch out for sensitivities. Don't give them honey. We talked about that one as well because of the risk of botulism. Again, you know, the risk is super low, but you know, it is something that can really affect an immature immune system quite dramatically and lead to death. The other recommendation, I guess I didn't throw in there, is the recommendation for at least a year is avoid added sugars. Again, lots of studies looking at, you know, infants that are given lots of added sugars and, you know, the risks of type 2 diabetes and obesity and things like that later in life are higher the earlier the kids are getting all these added sugars. And it is so hard to do. It is amazing how often you'll have you have a baby, he's like not even walking, and you turn around and people are trying to give that thing candy. It's like, I don't know. Yeah, anyway, the joys of being a parent. People want to give you advice, they want to give your kids candy, they want to spoil them, they want to do all sorts of bad things for them. But it is what it is. It's not all bad. Kind of looking ahead, a few things to kind of touch on this. Our next unit is on basically nutrition of child, so kind of feeds into this, but just a few things to kind of think about that are related to this first year of life. There are lots of studies kind of looking at child nutrition. They're not sure what is involved in the first year versus the entire childhood package, looking at chronic diseases, diabetes, and heart disease and things like that. But there are some indications that that first year of life, giving good nutrition at the beginning is super important to prevent these kind of things. Lots of other things that you'll see in the parent guides are around teeth nutrition, right? There's sugar, there's lactose in the milk, and when the babies start to get teeth, you know, they keep the milk in their mouth, and it can actually rot the teeth, right? End up with cavities and things like that, right? So you can see this one called nursing bottle syndrome, and they're just talking about the milk on there. So you know, something to think about, right? Something that you're starting to see a lot more in the news is discussions around childhood obesity. This is one of these things where we are not really, we're kind of trying to understand what's going on in terms of the theories about how this happens. You can see this here is showing how the numbers are basically increasing from 2004 to 2011 and whatnot. So there does seem to be a trend around this increasing of childhood obesity. Again, this is something we talked about before, and the factors involved are numerous, right? There's genetic, there's diet, there's activity levels, those kind of things. We do know that children tend to have similar BMIs to their parents, but probably no surprise. They're having similar nutrition, probably similar activity levels. They've got probably the same genetics and those kind of things. So all these things are things to think about. This is kind of the typical obese child, more likely female than male, more likely non-Caucasian. And family history of having these kind of things that are associated with obesity, right? So type 2 diabetes and those kind of things. And you can see talking about more sedentary, low family income, that's another one. Usually low family income is associated with high processed foods and often high calorie, low nutrient density foods, those kind of things as well. Tons of theories around it. Again, going back to breastfeeding, there tends to be slightly less children who are breastfed than formula fed that are obese. You know, there's so many things around this fetal programming in terms of the mother's. There's sort of the two contradictory things going. If the mother is extremely overweight, it's likely the child will be large, which will lead to childhood obesity. But also, if the mother is underweight, there seems to be a higher prevalence of that child having obesity problems. So kind of contradictory things in terms of what's going on during human development and all those kind of things. So I think really the key is to be healthy overall, I suppose. But I didn't want to, like I said, get into all this in tons of detail. There's a lot of contradictory science on this, trying to understand, you know, these trends and all that. This is talking about complications. And they're all the usual complications you would see with diabetes for an adult as well, which can be exacerbated when the child does become an adult. Lifestyle recommendations. You know, there's a lot of recommendations around giving kids food, right? In terms of, you know, should you bribe them? You know, should you reward them with food? You know, all of those kind of things. This kind of gets into that realm of parenting advice, and I'll give it to you if you ask, but I don't really like giving parenting advice unsolicited because I know I don't like getting it necessarily unless I ask for it. But a lot of recommendations around that. Certainly there's psychological studies that show that there can be, in some cases, you know, some people are very good at rewarding their kids with treats for various things and, you know, doing their chores and whatnot. And that leads to habits, which, you know, again, long-term habits can lead to lifestyle, you know, habits and those kind of things. And, you know, again, kind of getting that healthy balance is what you want to encourage, right? So there's nothing wrong with rewarding your child with things, but maybe, you know, rather than rewarding them with a cookie, you know, maybe a piece of fruit, right? Or something like that. You can, you know, those kind of things, those are decisions that can be made around you being a parent. And like I said, I don't want to get into giving you unsolicited parenting advice on those kind of things, but there's some suggestions right there. Obviously added sugars and high nutrient or high calorie things. You know, we're not looking at making those lifestyles, but, you know, maybe meals to be enjoyed, but maybe not having pizza every day, right? Those kind of things. Okay, so that is it for topic 13. Two more topics. They're relatively short. I want to talk more about children today. How are we doing? Wow, time is going fast here. A little bit more about children. Again, trying to not get into all of the, I don't want to necessarily give you all sorts of parenting advice unless you really want it. You can ask for it anytime, but I've got, like everybody who's been a parent, certainly opinions. Okay, keep going on about children here. So just moving on to a little bit older here. So here's my first advice about having children and trying to feed them. Good luck. Every child is so different. And it's amazing, you know, the frustrations you're going to have, and everybody has different frustrations. Here's a toddler who's throwing food. For some people, they're like, whatever, it's a toddler. For some people, they are pulling their hair out of this trying to prevent this. And there's probably 100 books written on just how to prevent your toddler from throwing food. So I think my first piece of advice is not just necessarily good luck, but that there's lots of resources out there. Okay, this is more concrete advice or things to consider. Every child is different. If you look at activities, their home situation, gender, they grow at different rates. Some kids seem to grow slow and steady. Some seem to not grow for like an entire year and a half, and then boom, they gain 10 pounds. That's kind of the way things are, right? So many differences. Mental changes. My first child, when he was starting to eat foods, it was crazy. He would eat anything. It got to the point where we were looking in the grocery store for the most disgusting things possible, just as a joke to see if he'd eat them, and he did, right? And then somewhere around a year old, something changed mentally where suddenly he became a lot less trustful of foods. Toddlers are notoriously mistrustful of new foods, right? And so again, this is where there's probably 1,000 books on how to feed your toddler and trying to expose them to new foods and those kind of things. So when you get there, look for the resources. Nowadays, we have resources everywhere on the internet and many, many other places. Alberta Health Services has a pretty decent material section on feeding children and toddlers and all sorts of things. And if we get a chance, we'll take a look at some of those things. But keep trying. Good luck. Every kid will have its own challenges, whether it's nutrition or something else in life. But it's part of the package of being a parent. So you can see, maybe I didn't define some of these things, but generally these are the typical definitions, right? An infant is up to about a year. A toddler is age 2 to 3, preschooler, and so on. Again, a lot of these have, you can take classes on children development, and there's many physical, cognitive, and other things that are happening at all of these different stages. And as I mentioned, with the food allergies, for example, I have a son with food allergies, and there was a point where he was exposed to peanuts, and he was old enough to say, my tongue feels funny, right? And so that's great, right, when they can do that. And that's part of the package of dealing with these things. So if you take a look at this, right, this is showing your infant versus your toddler, and in terms of the nutrient requirements, right, and those kind of things. And you can see that when they're, like as I mentioned, when they're first born, they need a whole bunch of fat, right? That's what they need. Support for the brain development. There's lots of energy and fat. They're consuming energy like crazy. I can't remember what the numbers are. They double weight in like 5 months, and then in the next 5 months they double or triple again. I can't remember what all the stats are, but it's crazy if you think about how much this thing grows in such a short amount of time, right? And so energy is very important. Obviously, those other things are important, all the vitamins and protein and those kind of things, iron being kind of a big one, right? So there's some numbers. The textbook's numbers are slightly different. I just couldn't find numbers for every category, whereas this site showed different numbers here. But you can see there's a couple of things, right? The amount of calories required for a child is increasing. So you can see from about age 1 to about age 8, it's doubling roughly. And you can see that the amount of calories from fat actually in the first roughly 2 to 3 years of life is very high, 35–40% kind of range. And once they hit about age 4, sometimes 3, the fat requirement is less, and it's a little bit closer to what you might see for an adult. Again, it depends on the child, right? And depends on what they're eating, right? In terms of overall, some kids, it's not a problem getting fat in their diet. It's problem is getting other things into their diet, of course. So what do we need to think about when feeding a child, right? All the usual things. Carbohydrates, they need carbohydrates. This 130 grams is based on, how much the brain needs, right? And for many children, carbohydrates is not the problem. It might be fiber. A lot of kids they're fine with eating toast and cereal all day. That's not necessarily the problem, getting them enough carbohydrates. It's about getting the balance of getting the fruits and vegetables and things in there. Protein doesn't have the actual recommendations, depends on the child's size. Most Canadian children don't have a problem getting the protein they need in terms of the Canadian diet. Obviously, as the body gets bigger, it's going to need more protein and those kind of things. So fats, this is the big one, right? Making sure that young children particularly get enough fat in their diet. I can't remember, it probably said in one of the slides with the infants, about exposing them to cow's milk. Around 9 months is recommended. And usually when they say give them cow's milk, they're saying give them the homogenized milk. So that's, I think, 3.2% or something like that. So it's a higher fat because that's what they actually need. They need more fat in their diet. And in fact, when kids are starting to crawl and walk, some of them are just too busy to want to eat. And so sometimes that is a concern, getting enough calories into your infant or your toddler because they're just too busy to eat. They want to run around and so you trying to give them higher fat things can actually be a good thing, right? Of course, the essential fatty acids are something that we really want for eye and brain development and those kind of things. And we don't want to be dieting our kids. There have been cases of people concerned about childhood obesity and depriving their children of essential nutrients because of this, right? So it's a matter of getting that balance in there, right? And so don't diet your 3-year-old, please. You can get nutritional help if you're concerned about obesity. Vitamins and minerals, all the usual ones, depending on the size of the body, the more are needed. Iron is kind of the big one that we're always concerned about. Getting enough iron into a growing body is a big deal, right? And worldwide, it is maybe one of the biggest concerns. Calcium is in there as well. Again, kids that are drinking a certain amount of milk products are not usually the ones at risk. It's more vegan children that may be calcium deficient because, of course, calcium is used for building bones, and these kids are growing bones like crazy. So here's some of the links for the Alberta Health Services. And I'm not going to go through all these documents, but I want to click on a couple of them just to show you what kind of resources are available out there for you. So I'll just load this up here. And so this first one here, Feeding Toddlers, I thought I wanted to show this one to you. Let's see here. Okay, open the file. Make sure I'm sharing the proper file. So you can take a look. You can see that, as I mentioned, there's lots of resources out there. It's always good to take a look at the current stuff. So if you've looked at the stuff with the first child, it's not a bad idea, when you have number 2 or number 3, take another look and see if anything has changed in here. This one here I like because it talks a little bit about the feeding relationship, and it's something that is really, it's great advice, but it's so hard to do. You can see it says here the parent decides what food and drinks are offered, when food and drinks are offered, and where the food and drinks are offered. Again, good luck with that. Anyone who has ever had a toddler knows that it's so hard to feed a toddler. They're running around all over the place, and then suddenly they're hungry, right? But you're making dinner, it's not going to be ready for 20 minutes, okay? So it's something that, it's, one step backwards, one step things to work towards. For some people, this kind of, these patterns can take years to figure out how to get your child to sit down when the rest of the family is sitting down as a meal and those kind of things. Never mind other people trying to feed it. Your child, sometimes you're planning a meal for your toddler, and then you 20 minutes later, you look and the toddler has already convinced an older sibling to feed it, a whole bunch of crackers. And so now it's not going to eat all the vegetables or whatever, right? So, this is kind of the standard advice, right? Is to those kind of things, but here's the other thing, right? The children decide how much to eat and whether to eat, right? So if you're giving them healthy choices, hopefully they can use their bodies to monitor how much and when to eat. One thing that is good about children's bodies is they're a little bit better at kind of knowing how much they need to eat, generally better than adults. For adults, for example, it's really easy to overeat. Toddlers, on the other hand, they eat when they're hungry, for example, in general. Sometimes, like I said, the concern is that they're not getting enough calories, but you're not going to be able to force feed them in most cases. But generally, they have small tummies and they know that they're full. Unfortunately, like I said, sometimes the problem is they're hungry now, And so you're dealing with it, but trying to give them that healthy variety is always a good thing. What else is in here? Like I said, these things are always really good to look at, and talking about patience and teaching kids to eventually feed themselves, use a spoon, all those kind of things. And you can see there's common eating habits like refusing food, won't try new foods. Again, depending on the child, children are there's all sorts of studies on children and exposure to new foods. And one of the numbers I keep seeing over and over again is a kid may need to see a new food something like 16 times before they might try it. Crazy, right? So it's good for them to see you eat, to see what you're eating and what's normal. And eventually they might take a nibble or a bite or something like that. One or two kinds of foods for a few days or longer, again, very typical. Some of these toddlers seem to be existing on air and water for days on end. And then suddenly they get really hungry. And all these kind of things are normal, right? And obviously, talk to pediatrician or something if you're concerned about their habits. Won't eat vegetables, so there's all sorts of suggestions here. Won't eat protein, won't drink milk, drinks too much, juice and soda water. So like I said, these resources are really, really good. I'll show you one more of these other ones here. Oops. Let's take a look at 1 to 4 year old. Make sure I'm sharing this with the group. Oh, there we go. Yeah. So here's 1 to 4 year old, and you can see that this is the kind of thing that they hand out at daycares and stuff, right? And they're trying to show people, what a serving size might look like for a child and whatnot, and always lots of suggestions. And generally, what we're trying to do is teach them, and if they can eat what you're eating, that's great. So eventually that might be what you're transitioning towards, but maybe instead of giving them a full serving, you're giving them a serving that's appropriate for their body size. And again, every kid is different. Some kids can pack it away. Some kids are full after like one baby carrot. It is what it is, right? And that's part of trying to learn how to feed your child and doing it in a nutritious way. Okay, so let's see here. Where is that? Like I said, I don't want to go through all of these guides in tons and tons of detail. I just wanted to show you that there's lots of resources out there, lots of suggestions, lots of ideas, and it's definitely worth it to look into. And like I said, keep in mind every kid is different. For our kids, I had no idea, right? With vegetables, how to feed them more vegetables, and and one of the things that worked, or actually two things that worked for us, was they're always hungry 20 minutes before supper's ready, so just have vegetables on the table. That kind of worked a little bit, but then what really worked? Dip. Go figure. I don't mind vegetables without dip. I use dip sometimes I don't. Never really thought of it. And then when I found out they like dipping things, you just suddenly go through the grocery store and find all the different types of dip until you find the ones they like. And that actually worked really, really well. So, again, that works well until it doesn't. Suddenly they become teenagers and suddenly they don't eat vegetables like they used to. So you're ending up with new challenges and whatnot. But anyway, like I said, lots of suggestions out there. Iron-rich foods. Always think about iron if you're concerned about iron deficiency and those kind of things. There's lots of feeding guides for getting iron into the diet, particularly vegan children. We want to make sure they're getting enough iron in the diet. But you can see the meat, particularly red meats, is where you can get a lot of iron. What else was I going to say about iron? Yeah, there's another feeding guide, another iron suggestion. Again, lots of ideas there, right? So the other thing to say about iron, not recommended for kids, right? There are, people can get iron toxicity. Kids are more sensitive to toxic concentrations of things. Their bodies are much smaller. So don't do iron supplements unless, you've got a prescription or a recommendation from a specialist, right? Iron obviously is very important, but the supplements, like I said, we are concerned about toxicity levels as well. Lack of iron, right? It's in the blood, so that affects the brain and energy levels, those kind of things. Okay, so where are we at here? think I touched on some of these things already. Fear of food being universal. Experiment as a parent. There's so many things that pop up, right? In terms of, trying to figure what they're going to have for their lunches when they start to go to school and those kind of things. And, for me, like, I was just like, you can't send peanut butter sandwiches with kids anymore to school, right? What do? That was kind of the standard staple since the beginning of time, it seems. And now you can't do that. So you got to look into things and find new things. Let's see here. So a few minutes left. I'm just going to finish off talking about allergies, okay? Since we kind of touched on them a little bit already. So I just want to define a few things, right? There are food intolerances and there are food allergies. So an allergy is an immune response. And it's your body's recognizing something and it's mounting an immune response. So antibodies and all those kind of things against it. Food allergies, right? A whole bunch out there, peanuts, shellfish, milk, eggs, mustard, sulfites, wheat. There's a bunch of food allergies. In some cases, these can be fatal, right? Symptoms you're looking at can be skin rashes to swollen tongues to sometimes breathing distress. So that's called an anaphylactic shock. That's where it's fatal. That's the thing that we're concerned about. A food intolerance is where your digestive system doesn't like something and can cause bloating or diarrhea or constipation or something along that lines. The most common food intolerance among adults and some children is lactose intolerance. So like I said, digestive distress. As far as I know, never life-threatening. Sometimes we talk about food aversions. Food aversions mean you're not eating food for various reasons. I have a food aversion against eggs, by the way. I don't know how old. I used to eat eggs. I can still imagine loving eggs, but I was sick one time and threw them up. So now when I smell eggs or see eggs, I have that feeling in my gut, right? Every once in a while, I'll take a little nibble and enjoy it, but that's a food aversion. Usually not life-threatening either. There are some exceptions, and we're looking at serious psychosis issues where people are not eating. There was a case I was reading in the news about a girl, and the only thing she was eating was Mr. Noodles, right? So imagine, and we're talking about like for years, this child is extremely malnourished. So there are some psychoses where those are issues. So these are the major food allergens, by the way. Probably most people are familiar with somebody with something on that list. In terms of what's going on in Canada, here's the top ones, right? So peanut allergies are number one, and apparently 2.4% of the children population. You can see that the numbers go lower with adults. Depending on the food allergy, a lot of food allergies kids will outgrow. Some are less likely, like peanut allergies, it's about 25% of them will outgrow it when they become an adult. The other 75% are stuck with it for life. Again, depends on the allergy. You can see all the usuals on here, fish and eggs and milk and wheat and those kind of things. So I guess we talked about this already. If you suspect an allergy, whether it's a young child or a little older child, try eliminating from the diet and see what happens and see if that changes. There are tests for allergies. There's blood tests and skin tests and those kind of things. And if you're concerned, that's the kind of thing that you'll want to get checked out, particularly if it is something that could be relatively serious. Definitely want to get it looked into. So I think this is where I wanted to finish. Let me just take a peek here. Yeah, so 2 more slides. So how do we manage food allergies? Generally, avoidance. And it's really important to teach the child what foods to eat or what not to eat, or teach the child to say to adults, does it contain peanuts or whatever the allergy is? Or can you read the label? Those are good things to teach your child. And then we can avoid having any accidents. And it's important that you as the parent or caregiver or teacher or whatever, to always read the label every single time. And I'll show you, the next slide is going to have some labels I'll show you as well. If it's a life-threatening allergy, the child may have an Epipen. An Epipen has adrenaline in it. And there are alternatives. Apparently, I've never, ever seen one. So Epipen is a trademark. and it basically contains a shot of adrenaline. So if somebody's going to an anaphylactic shock, they can't breathe, the adrenaline actually open up the airways. It does a bunch of other things, the heart and things like that. But that's kind of the main thing, allows the child to breathe and basically get themselves to emergency, because adrenaline, 10 to 15 minutes, it kind of lasts, right? So usually what happens when you get them to emergencies, they're giving them antihistamines. Antihistamines can take up to 20 minutes to work, and the antihistamines will counteract the effects of the allergy. That's kind of generally what we're doing. So the number one thing we can say about allergens, though, is to always read the labels, and read them every single time. Okay, because you never know. In Canada, our labeling system is pretty good. And most foods produced in Canada, so not all foods are made in Canada, the labeling may not be quite as good, will have a warnings list at the end, right? It'll say may contain or contains. You can see this one on the left. This is from a box of granola bars. It tells you what it contains. But notice this one on the right. It has a may contain on there, but in the main ingredients list, they have peanut butter, almond butter. I should have circled that one too. So some of the allergens are in the main list as well. And always read the label, because sometimes it changes, or sometimes you might have some chocolate bars are produced at multiple factories, and factory A is peanut free. So for example, Kit Kat is a good one, which is usually peanut free. But you know, they I don't know what company they are, Hershey or whatever, they have multiple factories, and some Kit Kat products have peanuts in them. So watch out for that kind of thing, and always read the label. Sometimes it changes. You know, sometimes the company changes their manufacturing processes and things like that. So one more slide. Sorry, I just remembered one. Got to show you this one here, because I saw this at the grocery store and I thought it was funny. So check this one out here. So this product is gluten-free, peanut-free, tree nut-free, dairy-free, egg-free, soy-free, corn-free, mustard-free, sesame seed, holy cow. I couldn't believe this. I thought it was hilarious. But anyway, you're paying, this is like sesame butter cups, so like peanut butter cups, but with sesame butter. I'll just say you pay a lot for getting none of these things. But anyway, I thought I'd show that to you.
At least, like, you know, it's a good staple for like birthday parties nowadays.
Yeah.
Really, what's the substitute for that?
Well, it's dark chocolate, and then it has a sesame, like a sesame butter, which is, I guess, a peanut butter substitute, right?
That's the teacher that I would give my kids for treats. Pardon me? Actually, wait, maybe if we're at an apple school, then we can't give it because there's chocolate.
I actually did buy one for my son, and that actually was very tasty. Yeah. Anyway, that's it for today. I'll see everyone on Friday.